Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today we have an exciting show prepared for you. Shelburne Stevens, our president of Novant Health Brunswick Medical Center, will be on site at the hospital to introduce us to the Da Vinci robotic surgical system. We will talk with Dr. Richard Thompson of Novant Health OBGYN about how he uses the robot for gynecological procedures. And then with Dr. Lydia Labachetta of Novant Health Urology Partners to hear how she uses the Da Vinci robot for urologic procedures. Finally, we will meet Dr. Philip Kahn, a new plastic surgeon who has recently opened Novant Health Coastal Plastic Surgery.
We're excited to be here today in the operating room at Novant Health Brunswick Medical Center. And before we begin talking about the Da Vinci robotic system behind us here, I want to introduce the community to our guest speakers, Dr. Richard Thompson of Novant Health OBGYN and Dr. Lydia Labachetta of Novant Health Urology Partners. Dr. Labachetta, why don't we start with you and you tell our viewers a little bit about yourself and your background and education.
I am a urologist here in Brunswick County, and I am a general urologist, which means that I see just about any urologic problem, and that ranges from surgical problems to non-surgical problems. My background in terms of education is not really in medicine at all, but then I did go to medical school, and I went to medical school up in Norfolk, Virginia, and did my residency training down in Charleston, South Carolina. So I've been up here for a little over a year, and I love it.
Great. How about you, Dr. Thompson?
My name is Richard Thompson. I'm an OBGYN with Novant Health OBGYN. Me and my partners take care of everything from general GYN problems to obstetric care as well. My medical education is in Virginia also. I went to the Virginia College of Osteopathic Medicine, and I did residency training in Wilmington. And I've been with Novant for a little over 6 months now.
Great. Well, we're excited to have both of you here in the community and practicing at Novant Health Brunswick Medical Center. But we're going to get to what we're here to talk about today, and that's the Da Vinci robotic system. So,
yeah.
Dr. Labachetta, why don't you start and tell us about the robotic system and how it works?
Well, I think that the two most important things that the robot does is it enables us to perform, number one, laparoscopic surgery in the pelvis. Dr. Thompson and I both operate in the pelvis, which is basically a bony bowl. And doing laparoscopic surgery down there is like using chopsticks to operate at the bottom of a soup can. You're kind of limited by the range of motion that you have in the pelvis. And so the Da Vinci robot has articulating wrists, which makes us able to perform these laparoscopic surgeries in a very narrow surgical field. So the other thing that the Da Vinci does is it gives us a microscopic view, which is really important when we're performing dissection in these very delicate tissues. So it really enables us to do microscopic dissection in very delicate tissues under direct vision. And then the other two things that it does that aren't necessarily important for the patient are it's a lot more comfortable for the surgeon because we're actually sitting down for a large portion of the case. So for complicated, complex, longer surgeries, it's a more comfortable way to perform the surgery, and also it's a lot of fun.
Mm-hmm. It's like playing a video game.
Yeah.
So what type of procedures would you do, Dr. Labachetta?
Well, urologic procedures in the pelvis and the abdomen. So anything from the kidneys down to the bladder. So nephrectomies, which is removing the kidney, partial nephrectomy, removing a part of the kidney, surgeries in the pelvis, including prostate removal. I think that's really where the Da Vinci kind of got its name, is with prostate surgery and prostate removal. That really is the place where we learned how important that microscopic dissection is, because you can see everything that you're doing down there in a way that when the people who trained me were training, they never saw the surgery they were doing because it was so far down in the pelvis. So.
And how about you, Dr. Thompson?
Hysterectomy is the big thing that I do on them, and the thing that's great about this system is it allows us to do surgeries that normally would have required a larger incision on patient's abdomen to be completed through laparoscopic means because of the great visualization of the robot. Also, we are doing pelvic floor repair work, so women with what they term pelvic organ prolapse, we can fix that through small incisions on the belly and give women a very nice result. So,
great.
Yeah.
So I would imagine the recovery time is faster for the patients?
I think so. I do. Most of the surgeries that are done laparoscopically are done that way to improve recovery time. And I think that has played out with the Da Vinci robot just like it has with other laparoscopic surgeries.
Great.
Yeah, less pain, less blood loss, and in a lot of cases less OR time than would be required for other means. So.
Good.
And kind of highlighting the size of the incision, in terms of recovery, a lot of the surgeries that we used to do were through large incisions that did carry a risk of herniation with increased intra-abdominal pressure, meaning if you went to go pick up something heavy, you was going to pop something out. And so obviously when we're using these ports that are so small, the risk of having bowel herniate through those incisions is dramatically decreased. So.
Great. Well, this looks intimidating. It's a large piece of equipment, so I think it'd be good if you could demonstrate to us how the robot works. So Dr. Thompson, if you'll get to the console there, and maybe Dr. Labrichetti, you explain what he's doing to our viewers.
Absolutely. So when we're operating on the Da Vinci robot, the surgeon is always in the room. There are Da Vinci surgeons who run a console in a separate room. We don't do that here. This is Rosie, our friendly robot, and she she carries out our intended movements. So what I mean by that is we don't get to come over here and plug in prostate and then Rosie goes. So Dr. Thompson over here is doing everything that you're seeing happen here. Also, our surgical assistants are standing at the bedside, and there's usually an additional port so that they can pass things like needles and things like that to us. You can't really appreciate it as we're looking at it here, but what this would represent is a patient lying here, and all you'd be seeing from the outside would be the belly.
Wow.
And then Dr. Thompson would be seeing the inside of the patient. So the assistant really only sees the ports from this side out. And so all of the sutures that we use have to be passed in through an assistant port. And also the assistant very often will help us with things like retraction and things like that. But as you can see, all of the movements that are being performed surgically are being performed by the surgeon, who is Dr. Thompson at the console here. Another thing that I think is really that's difficult to appreciate as you're seeing this from the outside is the view that Dr. Thompson has, because with traditional laparoscopy, we were operating with a camera that has one view. Well, we have two eyes, so we can see in 3 dimensions. And the Da Vinci actually lets us do that. The Da Vinci camera has 2 eyes, and so the surgeon is able from the console to see everything that he's doing in live time in 3 dimensions. So what that means is that depth perception is much more keen, and you can really see when you're manipulating tissues how those tissues are moving toward you or away from you. So you can tell when you're applying undue pressure and things like that.
Wow, that's impressive. And I see what you mean about him being more comfortable sitting down at the console over there. That is much easier for the surgeon.
I mean, some of the he mentioned decreased surgical time, and that's great when that's the case. But some of the surgeries that we do are very involved and very lengthy, and so it does decrease surgeon fatigue, and it gives us the opportunity to make sure that our patients are having the safest surgery possible, because we're as comfortable and alert as possible, and not standing here thinking about, God, my back is killing me.
That's great. Well, Dr. Labachetta, that was extremely interesting. I'm sure our viewers appreciated that. I think now we'll go over here and join Dr. Thompson at the console so we can see what he's actually doing at the console and have that perspective as well.
So what I'm doing here is throwing a suture to sew up a incision on our fake skin. Basically what I've already done is thrown the suture through one time. And one of the things that's nice about the robot that we don't get on normal laparoscopic surgery is we're able to actually tie knots using the arms of the device inside the patient's abdomen, which allows for better surgical result and quicker operating time as well. But you can basically see how the arms of the robot and the mechanics allow for it to be more like a wrist action, whereas normally on a laparoscopic instrument we would only have one. We would basically have the ability to open and close these instruments and rotate them like that, whereas here we can move back and forth and articulate really well. So basically, as you can see here, we'll take this, and this is going to be like a normal human hand almost, the ability to throw a suture through and really see very well what you're doing. You can control the camera by the pedals underneath us, which allow us to zoom in and see very closely what we're doing.
This is impressive how you're able to move your hands and work the pedals at the same time while the patient is a few feet away. That's impressive to me.
Yeah, and it's nice to be able to control everything from this one console, not only camera, but you can clutch to help adjust your arm movements to allow for better surgical technique, and also the pedals on the robot have the ability to use cautery, which allows us to achieve less blood loss and better hemostasis, as we say, during the surgery, and also allows us to do certain things during the procedure that we might not be able to do otherwise.
Wow, that's amazing. So Dr. Thompson, why don't you join us back over here at the robot, and we'll let you and Dr. Labachetta tell us a little bit more about the procedures.
One of the things that Dr. Thompson mentioned was the cautery that we use. We use that to basically burn the tips of blood vessels so that they stop bleeding, so that we have less blood loss during the surgery. And we also use those to dissect during the surgery too, with less blood loss, just like we would in an open surgery. But we obviously need to change instruments when we're using one instrument that is a burning instrument, and we need to do something like this. And one of the great things that this robot does is it has memory for where each of the instruments is right now. So if I wanted to have my assistant trade me out to scissors on one side, for example, they would just be able to unsnap this and take the instrument and put it on the back of the field and take scissors or whatever else I asked for. And then when they engage with the robot, and they move back into the exact same position.
Wow.
So that is all, again, controlled by the surgeon. So it's wonderful to have the great assistance that we have, but the technology is able to keep the patient completely safe. So you don't have to worry about your bedside assistant taking the instrument and maybe losing focus of it and having it go into a place in the pelvis that you don't want your instrument to end up.
Right.
So it's all very controlled. And the other thing that you maybe didn't really appreciate is the camera itself, and can be, moved in and out at the console there. So we can get up close and personal with these tissues as we're dissecting. Mm-hmm. I mean, you can see, I think that there are some images that the viewers will be able to see of the microscopic surgery and how detailed the tissues are under that.
Dr. Labachetta, that's a good point. Why don't we take a pause and let's let the viewers see the video. So are all patients eligible for the robotic surgery?
Well, I think that we probably wish that they were, but most patients nowadays have had some intra-abdominal surgery. If they haven't had a laparoscopic cholecystectomy, then they've had a C-section, and so some of the dissection is limited by the tissues, and mainly getting these ports in is limited by the previous surgeries. So patients who have had a history of a big, crazy abdominal surgery, probably not the best candidates for this type, but we evaluate each patient on a one-by-one basis. So certainly there are patients who have had previous abdominal surgeries that we still do robotic surgery on.
Oh yeah. Actually, one of the nice indications for this is women who have had multiple cesarean sections before. They have a lot of scar tissue, and this actually allows us to get their hysterectomy done a little bit easier than otherwise would be. But yeah, you're right, exactly right. Other multiple abdominal surgeries may limit us, but in general, it's pretty broadly available for use on a lot of different types of patients. So.
What instructions do you give the patients before they have the robotic surgery? Anything particular, different?
Well, I think that anybody who's going into surgery should be in the best shape possible. So, we try to get everything optimized. We want them to be exercising and eating well, just like we want all of our normal patients to be. There isn't really much from my standpoint that they need to do preoperatively.
Nothing special, no.
Great. So I understand both of you are accepting patients today. So Dr. Labachetta, how would they get in touch with your office to make an appointment?
Well, we have a fabulous scheduler, Lena, who has just been joined by another fabulous scheduler, Amy, and they're really great, and patients can call us at our office. The number is 721-4150, and myself and my partner, Steve Robbins, are taking patients.
Great. And for you, Dr. Thompson?
And our office phone number is 721-4050. And patients can call and get set up for an appointment, and we can discuss things from there.
Great. Well, it's been great having you both with us today, and this has been impressive. And it's great that we have this new technology here in Brunswick County, and that we have both of you here who can use it and serve our patients. So thanks for joining us today.
Thank you.
Thanks for having us.
Welcome, Dr. Kahn. It's great to have you here today, and it's great to have you in Brunswick County. Why don't we begin by you telling our viewers a little bit about yourself. You grew up here, correct?
Yes, I grew up here. I was raised in Holton Beach, North Carolina, and I lived here until I went off to college back in, I believe, 1995.
Good. And if I remember correctly, your father was a physician here?
Yes, yes, he was. He was one of the first doctors here over 30 years ago, about 38 years ago.
Wow.
He came and was the first general surgeon at the area of the old Brunswick Hospital, so to speak, near where we are right now.
Mm-hmm.
He was one of those, what they call old school general surgeons, did everything. And he was a general practitioner, kind of like your family doctor at the same time. Served the community for well over 35 years in a small office on Highway 17 where my mom was the nurse.
Wow.
Did everything by hand, no computers, and really the house at home was our office. The door was always open, and he really instilled that in me quite a bit with how he was embraced in the community and how much he embraced it.
I've heard lots of great stories about your father, so it's good to have you back here. Is he the reason you decided to come back to Brunswick County?
It really is. It really is. Just, I feel they always say that the beach calls you back. I spent time in a lot of big cities, from Charlotte to Austin, Texas, and they always say that the beach calls you back, and I feel that's what it was. The community embraced him, and he always just instilled that sense of giving back to where you're from, as did my mother, and I think that was the biggest importance drawing me back now.
Your mom's still here in Brunswick County, correct?
Oh, yes. Oh, yes. People see her all the time at the food line and all the grocery stores.
I'm sure. So why don't you tell our viewers a little bit about your educational background?
Well, I graduated high school in 1995, but then I went off to Chapel Hill like everybody else in my family does for my undergraduate. Went away to East Carolina, real far away from Chapel Hill, for my medical school. And then I did, unique to some of the new plastic surgeons that are training nowadays, I did full general surgery training. So I trained as a general surgeon in Charlotte and in Spartanburg, South Carolina. Did some research in general surgery then as well. Then I decided to move halfway across the country, and I went to Central Texas to Texas A&M, where I did my specialty training in plastic surgery. There I did a lot of full-scale plastic surgery, but really focused on complex reconstruction with microsurgery and cancer reconstructions, as well as trauma reconstructions. And then I decided to come back to North Carolina in Charlotte, where I did one of the high-volume cosmetic surgery extra training fellowships in order to broaden my skills really in that. And then I decided to come back home.
Well, that's excellent. It's great to have you back here in Brunswick County. So I see that you studied aesthetic plastic surgery. Can you tell our viewers more about that, what that means?
Oh, yes. On top of all my reconstructive things, I did an extra training year in order to learn aesthetic plastic surgery, which is really cosmetic surgery. Those are the things that people see on television in terms of facelifts, breast augmentation, liposuction, and really some things that it really entails also are basic skin care, Botox, injectables, and things that are very popular and things that we're really going to offer a lot of in the office. The beauty of those type procedures like Botox and skin care is there's things that people can come and do on a 15 to 30 minute basis without really much ahead of time, and it's sort of an in and out type thing. We'll be offering a full scale of injectables and Botox, as well as really a skincare line, which is really a part of the total care from the cosmetic standpoint that we really focus for.
Great. That's good that you're doing some procedures in the offices, and it'll be easier for your patients as well. So what types of procedures are you going to be focusing on here? A wide range, or is there specific procedures?
There are certain specific ones that I like, but I get so excited just with everything about plastic surgery, the cosmetic side and the reconstructive side. I will have a full wide range of procedures, and a lot of that's part of the service to the community aspect of it, and I'll focus a lot on reconstructive surgery, which really focuses on, it could be anything from a small little mole that's taken off the face, or it could be something like a dog bite to the face that I really go back and kind of make somebody look better in terms of having a scar. Some of that also goes into the realm that I'm very passionate about is cancer reconstruction, particularly breast reconstruction in women. We have a really great program that we're going to try to start here, and that we will start for microsurgery in order to really be able to reconstruct women's breasts and offer yet another aspect of the total care that we're going to have here with the great general surgeons that we have.
Good. And you're doing your cases at Novant Health Brunswick Medical Center, right?
Yes, all of my cases are being done there, and it's a really incredible facility from all of the different places that I've worked and operated in, which has been quite a few. The ORs and the staff really just pay such attention to detail. It's a joy to be here and operating here.
Well, we're very proud of that new facility and its staff for sure, and very glad to have you back here and joining us as well. So we're in your office today, your new office. Why don't you tell our viewers where you're located at?
Well, we're located at 6 Dr. Circle, Suite 5, in the Office Medical Complex there off of Highway 17 in Supply, North Carolina. And it's really kind of where the old hospital was, in quotations.
Mm-hmm. And do you know the phone number for here?
Yes, it is 910-754-8808.
Great. And folks can just call and get an appointment for consultation? Do they need a referral from their primary care? Or?
They can call at any time for an appointment. Some things are referral based on whether it was a reconstructive type thing, but even then they can just call whenever. For things such as the cosmetic procedures that we're going to focus on, anytime they want to call, they can come in and talk to us. And I love to talk about plastic surgery. It's what gets me going every day.
I can see your enthusiasm as you talk about it here today with our viewers. You're very excited about it, and makes us happy that you're here in Brunswick County to serve the residents of Brunswick County. So thank you for joining us today, and thanks for your time.
Wow, what a great show. Thank you to Shelburne for being a wonderful host and for giving us this unique opportunity to see the hospital and also an inside look at the future of surgical robotics. And it was also great to hear from Dr. Kahn and to learn about this new service that's now available through Novant Health. Thanks also to our viewers for tuning in to ATMC TV's HealthWatch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email those to atmctv@atmc.coop. For more information on Novant Health Brunswick Medical Center, our local doctors, and just general health information, please visit novanthealth.org. Thanks again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.
We are ATMC TV, Channel 3 and HD Channel 910, your community channel.
Is 6:30 too early for a Get Fit workout? Are your weeknights too hectic to catch the West Brunswick football? Do you find yourself missing all your favorite ATMC TV shows? Well, now you don't have to. ATMC TV is airing all their latest shows on demand. Stop, pause, fast forward, or rewind. Watch your shows on your time. Tune to Channel 1 to see shows like Brunswick Biz, Get Fit, The Coastal Kitchen, and more. Stay connected to beautiful Brunswick County with ATMC TV on demand. Brought to you free by ATMC. ATMC TV works hard to bring you the best in local programming for Brunswick and Columbus counties. Our goal is to provide local programming that is interesting, informative, and entertaining to the residents of our area. ATMC TV also offers all their information at atmctv.com. Find out when your favorite shows are airing, watch current ATMC TV episodes, check the local bulletins, or even submit a public service announcement about your organization. Be sure to check us out on the web at atmctv.com.
The new ATMC Experience store in Charlotte is now open. Come in to check out our Try It Before You Buy It demonstration stations for digital cable TV, 100 meg broadband, and home security and automation services. Plus, we have a full line of wireless phones and accessories from AT&T. Whether you're ordering new services, paying your bill, or have questions, we're here to help Monday through Friday and Saturday too. The new ATMC Experience Store, Main Street in Charlotte beside Duffers.